Hello there. You're watching forpay.org. This is Consumers Doctor on the behalf of foremost organization. Forpay.org is a non-profit service oriented for you, and also the what the non-profit is forpay.org does it to educate why people think that buying a health insurance you're wasting money. This is what my focus has been. He can come out ahead buying a deductible health insurance, folks. Do not buy a traditional health insurance, because once you buy a traditional health insurance, whatever the premiums you are paying, you will never see them back again. That's one of the reasons why I recommend highly a deductible health insurance. What is health insurance deductible, you might ask? I'll give you the answer. Health insurance deductible is the amount of money you pay out of pocket for healthcare services covered under your insurance plan before your plan begins to pay benefits for eligible expenses. If you're healthy, if you don't have any healthcare bills to pay, or if you don't visit the doctors, or if you don't have any other health issues, best thing is to buy a deductible health insurance, folks. The amount you pay health insurance deductible is determined by the type of health insurance you have and your coverage benefits. I'll explain to you more. As a general rule, higher your premium, the lower your deductible is likely to be. If your insurance premiums, if you want to maintain higher deductible, then your insurance premiums are a lot lower. So I would recommend, if you don't have any health issues for you or any member in the family, I would highly recommend to get a deductible health insurance. That way you would qualify for a health savings accounts. Individually, you can contribute up to $250 to $300 every month individual. For a family, anywhere between $750 to $800 for a family of 4. That goes a long way, folks. You have a control on that health savings. You have 100% control. Suppose you can bring your premiums, deductible premiums, down by taking a higher deductible policy, because the higher deductible policy, what it does, by contributing to the health savings, you get to use your health savings money before it kicks in. But the advantage of having a health savings is you're able to invest what you're contributing to the health savings into so-called investments or index funds, which you will probably get a lot more appreciation than what you think. On index funds, it's more diversified and there's less risk, and it goes a long way, folks. I see a lot of opportunities in having health savings accounts for you and your family. Key takeaways, let me repeat again. Key takeaways are: your health insurance deductible is the amount you pay before your insurance plan benefits begin. You pay from your HSA. You don't have to pay from your pocket, but you can pay through your HSA. And another big takeaway is higher deductible health plans carry higher deductibles, but they can offer access to health savings accounts, which can be used to pay future healthcare expenses, folks. Future healthcare expenses. And another takeaway is amount you pay for the health insurance deductible correlates with what you pay for the health insurance premiums. If it's a higher deductible, your insurance premiums are lower. If it's a lower deductible, your insurance premiums are higher. It's inversely proportional to what you're buying, a low deductible or high deductible health insurance. Folks, I'm telling you, I know a lot of people have covered California, even they are eligible for health savings accounts. You should plan for you and your family, which goes a long way, folks, by having a personal care health savings accounts. You might ask how health insurance deductible work. That's another big question you guys have. When you buy a health insurance, you pay a monthly premium for your coverage. You know that. But however, that is not the only expense you will have. Health plans usually include a deductible that you must pay before your insurance plan will start to cover your eligible healthcare expenses. The deductible portion you have to pay from your health savings account. Suppose if you can afford to pay from your pocket, it is still the better, but you need to keep all your bills, how much you have paid for your healthcare services. Suppose if your health insurance plan has a deductible of $3,000, you will have to pay all your eligible medical expenses until you met that $3,000 deductible. At that point, your insurance will start paying for the services you use. If you have an individual coverage, you may pay one deductible for eligible healthcare expenses and another towards prescription drugs. If you have a family coverage, you may pay individual deductibles for each person who is covered, as well as family deductible for the policy. Sometimes an insurance plan will pay for certain covered expenses, covered services as a preventive care without requiring you to pay anything toward them to meet your deductible. That's called preventive care. Folks, health insurance deductibles are a way for insurance companies to reduce risk. It is less money they have to pay out of their pockets. Insurance companies also charge deductibles as a cost saving measure for you. So that deductible is a cost savings for them, and it's also, by putting the money into the health savings, a cost savings for you. It is almost like if you have co-payments and co-insurance. See, when you see a doctor, or when you obtain healthcare services in a managed care arena, you have to pay co-payments and co-insurance. It's almost like that your deductible, that's a deductible portion you have to pay from your pocket. I hope I made it clear, folks. This is not a confusing, as long as you know that whatever your deductible amount is, if you have a higher deductible, you have a lower insurance. If you have a lower deductible, you have a high insurance plan. So that's how your premiums are based on your deductibles. But in the process, you will be eligible for personal care, health savings accounts, which you have 100% control. You can put it in a brokerage firm, in HSA bank, and you will be able to control yourself without anybody's intervention. Personally, I like the way the whole concept is. If any member of the family who's sick and has a lot of medical care costs, then the deductible plan may or may not work. It depends on how you look at it. If you can pay from your pocket and keep all the receipts, you don't have to use your HSA. So you can keep on saving, accumulating wealth in your HSA account, folks. That is yours. It is better than an IRA. HSA account is better than an IRA. I'm telling you, it's better than it has a triple tax benefit, folks. It's a triple tax. Individually, you can contribute up to $3,600. And a family, you can contribute up to $7,500 to $8,000 every year. Can you imagine if you do that every year in 10 years? You will probably have about $80,000 to $100,000 for your family, and that continues to grow. And you would be careful when you incur healthcare costs, and you will be shopping around, and you are in control as a consumer. This is called consumer-driven healthcare, folks. Consumer-driven healthcare, so-called personalized healthcare. When you have a personalized healthcare, there are lots of incentives and rewards. You can probably implement by having incentives and rewards. You don't want to use your health savings because you want it to grow. That's the primary objective, folks. If there's a value which I'm giving you in this video, you should subscribe, share, and make some comments. I'll continue to emphasize what forpay.org. Forpay.org, what it basically is, you pay for your premium, a deductible, so-called deductible insurance premium. It pays you back 10 times, folks, in the HSA by careful planning. Yes, by careful planning. This is Consumer's Doctor. This is Dr. Bengalo on the behalf of forpay.org. Again, if you see a value, you should follow me, and you should subscribe to this channel. We'll continue to emphasize how to come out ahead in the health savings side. There are a lot of avenues you can come out ahead on the health savings. Thank you, guys. Goodbye. We will see you in the next episode.